Hello, today I will be reviewing central vascular access device malposition complication with central vascular access device. So causes include changes in intrathoracic pressure associated with coughing or sneezing, presence of heart failure, neck or arm movement, or forceful flushing of the catheter as occurs during power injection can lead to malposition of the central vascular access device. Malposition can also happen from migration with improper care. For example, the catheter is repositioned during a routine care by accidentally dislodging the catheter or advancing the catheter into the body. Tip migration also resulted from external catheter movement out of the insertion site, which could result from excessive arm movements with the peripherally inserted or peripherally inserted central catheter, or inadequate central vascular access device stabilization with sutures. So signs and symptoms. Signs and symptoms can be similar as with pneumothorax and hemothorax. Actually, when hemothorax or pneumothorax occurs, that would be the signs and symptoms. The signs and symptoms I covered in a previous video, so please watch that. Other signs and symptoms can be neck swelling or arm swelling on the side of the insertion. Tip migration into the right atrium. Tip migration to the right atrium can result in dysrhythmias, and patient may experience palpitations. Changes in catheter function are noted. Inability to flush the catheter, infuse anything through the catheter, and inability to aspirate blood. Patient complains of patient can complain of headaches, pain, or redness in the arm, shoulder, or neck. Also, there's a sign called Eargurgling Sign. So, patient tip migration to the internal jugular vein has been associated with this sign, the Eargurgling Sign. The patient complains of sound of running stream rushing past the ear. So you can determine that the catheter has migrated into the internal jugular vein. Also, changes in length of the external catheter segment may mean the catheter tip has migrated. So, prevention. How to prevent this from occurring. So, catheter tip must be verified before device is used with an X-ray. Also, when the peripherally inserted central catheter is placed through the basilic vein, which is on the inside of the arm, turn the patient head toward. When the catheter is placed through the subclavian vein, place the patient in a slight Trendelenburg position. Also, right-sided cardiovascular access device insertion is preferred. Care must be taken during cardiovascular site care to prevent inadvertently pulling of the catheter out of the exit site. So, treatment. Treatment of malposition of central vascular access device. So, we can remove the catheter and treat associated complications like with pneumothorax and hemothorax. Because the visualization techniques are used during the catheter insertion, quick identification of a problem is possible. Catheters can be repositioned using techniques such as flushing the catheter, or just simply repositioning the patient. If complications were identified, there might be a necessity to place the patient on oxygen or insert a chest tube, as with pneumothorax and hemothorax. If the catheter loops back into the axillary or peripheral veins, then repositioning of those catheters is highly unsuccessful. Catheters with simple looping into the subclavian on inanimate or internal jugular vein can be often repositioned by placing the patient in ipsilateral position with the head of the bed slightly elevated. Ipsilateral is towards the catheter. Also, guide wire can be placed into the old catheter, and new catheter may be inserted over the guide wire. This prevents any additional percutaneous cannulations. Catheter that were placed in the right atrium and caused the arrhythmias can be partially withdrawn. It's important to note that it's okay to withdraw the catheter, of course, after the practitioner was notified, but it's not okay to push the catheter back if you noted that the catheter was withdrawn. So when the tip migration is suspected at any time, notify the practitioner and obtain the orders to hold any infusion until the correct catheter placement is confirmed. It is important to recognize the catheter tip migration increases the risk for central venous thrombosis, thrombophlebitis, pericardial infusion, cardiac tamponade, and cerebrovascular accident. Never, never insert the catheter that has been inadvertently pulled out from the exit site. Stabilize it in place and report to the practitioner. Follow up with the chest X-ray film may be necessary to ensure correct tip placement. Alright, thank you. Thank you everybody for watching. Please like, I need 1,000 likes. And I wish you great success.